Good afternoon. Happy Friday. I'm Terry Scoggin, the CEO of Titus Regional Medical Center in Mount Pleasant, Texas. Today's Friday, February 5th, 2021. Also, as you can tell by the screen behind me, Go Red for Women. So this is our annual Go Red for Women in support of defeating cardiovascular disease and heart disease. And as we go through Cardiovascular Month in February, one of the things you'll see we post on our Facebook and through other companies around our region today is people wearing red in support of mitigating the death mortality related to cardiovascular disease. So thank you for your support, and thank you for the businesses who joined us today to wear red. And I appreciate Bobby D for giving me the screen behind me that's red in general. So a couple notes, we get in the numbers. Our numbers continue to stay steady and go down a little bit. From a Titus Regional Medical Center perspective, we have 13 in the health system today. A couple in ICU and the rest on the floor. This week, we've seen ourselves go down 15, 14, 13, 13, 13, 13, sitting around that 12 range, and then back up to 13, then back to 12. As a region, you can see that Region F has been 7 days as of the 3rd, below the 15%. Now, this is COVID positive in the hospital as a percent of staffed beds in our region. And you can see for our Region F, that we have been 7 days without. So you can continue to see us decrease, and this is as a Wednesday, will be the February 3rd number, 12.33%. So going down every day, consistently going down, so it's good to see. However, there's still 12 people in the hospital. Now, from our total in Titus Regional, our 12 to 13 as a percentage of just under 50, we're still seeing about 20-25% of the people in the hospital are COVID. So we're still seeing that number. From a Tyler perspective and south of us, you can see their numbers on the 3rd were 13.36, their lowest that they've seen. So I expect yesterday or today they'll hit their 7 days as well. So we can see those continue. And then to the west, in the big city, their numbers continue to go down at 17.15 in the Dallas region. And watch the news last night, you can see just the relief that's coming in some of those larger health systems and what they're dealing with. From a total room standpoint, we're down to 131 beds hospitalized, 50 ICU beds. Going up the last couple of days in the region, ICU beds, one of the numbers that I thought was very interesting from a Titus Regional Medical Center's perspective is we used our fewest amount of doses of remdesivir yesterday. And remdesivir is the medicine that we give in the hospital. And this was the first time that we've used such a low amount. We used 3 doses yesterday. And that's a treatment that you give for 4 to 5 days. So would love to see it. When I saw the reports this morning, that number came out. We could see some of that severe sickness in the hospital was not there. From a Tyler perspective, continue to go down, hit 116 beds as of last night, which this numbers is just reflective of a few minutes ago, but 385 beds in total. So when you see that number drop from 505 to 385 in less than 10 days, you've got to just continue to smile and hope that we're continuing this curve. The Dallas region, the same thing. You're seeing at 650 ICU beds and 2,600 total, almost 1,000 down over the last 14 days. The one thing that I'll just throw out there to talk about is when we talk about just different things going on with COVID right now is Super Bowl weekend. Do your best. And, I've said from the beginning, and I'm different than some of the people who've addressed this, and this has been a horrible experience for the world to go through. But we have to live our lives. So just be smart, social distance to the best of your ability, wear your mask, just be smart of how you celebrate Super Bowl Sunday and enjoy your snacks and everything. From a vaccine perspective, one of the things I wanted to address today is second dose. We have 700 people at Titus who've received their first dose and second dose. We've had 2 other shipments, a 300 and 400, who've received their first dose. We have not received their second dose yet from the state of Texas. We've not got that allocation yet. And that was one of the concerns when we got into this that we were worried about. We do believe we're going to have doses next week, so we think we're going to be okay. But as of right now, we have people that are coming up to their second dose. It started yesterday. They needed their second shot, and we do not have vaccine. So only thing I can encourage everyone who watches this to talk to your friends and family about, be patient. We hope and believe that the state will come through with those vaccines to us and we'll be able to administer that second dose. The CDC, we use Moderna, which is 28 days. The CDC has a few weeks after that as you're okay to get the second dose. And it's quite an increase on the number of days you actually can. We've talked to our infectious disease specialists here at Titus, and as long as you just get the second dose at some point, We just got to make sure of that. But people who are worried, people who are calling, we're receiving a lot of phone calls. I received quite a few emails today and phone messages. We know that you're scheduled for your second dose. We do not have it as of yet, but as soon as we have that ability to give those doses out, we'll get in touch with those people and get them on the list. And then as far as everybody else, we encourage you to stay on the list. We're pushing the state and we're pushing other areas. We will have doses next week. We just don't know the number. And we don't know if it's first dose, second dose. We're working on that to try and clarify that. And we should have a few doses to start going. One of the questions I just wanted to bring up is somebody's asked a couple times, why is TRMC unable to confirm someone is on the COVID wait list and what position number? We're not trying to hide the list. HIPAA prevents us from sharing the list. And even when you give information off that list to someone, there's a lot of things you have to do to prove that person who you're giving to is actually the person you're talking to. And from a HIPAA perspective, you got to be careful. But in addition to that, it's bandwidth. We don't have the people. And that's, if we just had somebody answer phone calls all day long to tell people if they're on the list or not on the list, then we'd have to hire a staff of 10 to 15 people just to manage that. If you got yourself on the list, we have your email address, we have your phone number. We're going to work through that list in some capacity as we receive more doses. If you have an opportunity to get the vaccine anywhere else, please take it. I know in the Dallas area and some other places, people are jumping at it. Again, if you have the opportunity to take the vaccine, even though you're on a waiting list, I encourage you to take it. Don't miss out on your opportunity. But I do ask everybody to be patient. Another question we got is, why is people under the age of 65 going ahead of people over the age of 65? And actually being accused of us using our friends and relatives. Well, that's not the case. And there are people who fall in 1B or 1A per the state's guidelines. A doctor can recommend somebody based on comorbidity, some of the issues they have, whether cardiac, kidney, liver, all different types of issues that the state list as a 1B, or based upon their role, they could be a 1A if they're a healthcare worker or a first responder or a last responder. So there's quite a few things that falls in the state's guidelines, and a physician has the ability based on concerns of the patient and the risk of that patient being high risk, they can put them in the 1B category as well. So I just put that out there so everybody knows. If you see your 22 or 24-year-old neighbor who's getting it, there's going to be reasons. And we are following the state's guidelines. The state watches us closely. We have to report that to the state and the reasons why we're doing it. So I understand the frustration. All I can ask is you continue to be patient and work with us as we go through that process. We want, as much as anybody, to get this in the arms as many people as we can. As we also talk about, this is Cardiovascular Week, so Cardiovascular Month. And one of the things we wanted to focus on is the different things out there to make better choices. And American Heart Association, if you check our Facebook today, as part of Cardiovascular Month, they have some things about making healthier choices. And go to our Facebook, check this out, but it's got some things about where's nutrients, what's good fats, bad fats, watch your sodium. Please follow us on Facebook if you don't. We are going to be having some other things throughout the month to focus on a healthier heart. But check out our Facebook today. And again, continue to make healthy choices. Even though we're in a infectious disease pandemic and we're dealing with COVID, we still have to focus on the other issues. We have to focus on watching our weight, watching the choices we make, making sure we're going to the physician to get our annual exams, and continue to maintain a healthy environment amidst a pandemic and a crisis. Again, I appreciate everybody who watches this on a weekly basis. We'll be back on Monday with our updates. Have a great weekend. Enjoy the Super Bowl. Do not eat too much of the bad foods. Remember, look at the source of nutrients and sodium up there on the screen as you pick those pigs in a blanket and the nachos on Sunday night about 6 o'clock. So again, we appreciate your support of Titus Regional. I will encourage you, follow us next week. We'll be doing some things on Facebook and on this edition of asking for volunteers. If we're able to get the vaccines in a quantity that we want, we're going to need help from the community. And this will be your opportunity. Many of you have asked me for the last 6 months, how can I help? You're going to have an opportunity to step up and do some things for this community and save lives. Thank you for your support. God bless.